Patients who are severe and critical are at a high risk, according to the Ministry of Health. Only 11% of the cases access health service countrywide, leaving large numbers needing palliative care in danger.
Stephen Adako, at 19, is the lone caretaker of his niece Aiden Francesca. Since she was diagnosed in March 2020, the Cancer Institute has been their permanent stay.
She got treatment for some months, and around October last year, they removed that eyes. Up to now, she's still getting treatment.
The early days of her admission were tough on the 3-year-old, but she finally turned a corner of hope. There is, however, a shortage of similar service countrywide, with large portion of victims missing service. Lubega Umal, a radio health expert, says the response must take into account all levels.
The treatment can either be radical, the intention is radical, or it can be palliative. With the radical, the intention is to cure the cancer. But then with the palliation, we are giving the radiation therapy treatment to the patient to, first of all, control bleeding. The patient always has pain because of the metastasis. The disease tends to spread to different parts of the body and it causes too much pain.
He also adds that palliative care emphasizes the treatment of symptoms.
Part of it is to control that pain in most cases.
Currently, only 11% of palliative care victims access medical care. Only 226 hospitals have the facility in place, says Mark Donald Mwesiga, Country Director, Palliative Care Association, Uganda.
We know that palliative care should be in every hospital and up to Health Center 4 in the entire country, but we know that there are only about 226 hospitals that have some form of service in the country. We also know that not all districts have palliative care services, that only up to 107 of the 146 districts have this form of care that we are talking about.
This, as of 2020 figures, registered a rise in cancer cases with 350 cases per 100,000 population. The stakeholders are responding. The Uganda Cancer Institute, the Palliative Care Association of Uganda, and the Ministry of Health will hold the 3rd Uganda Conference on Cancer and Palliative Care between 23rd to 24th of September. The gathering that attracts over 400 policymakers and the general public will forge a way forward. Shamim Natebo, SEETV, PM edition.